Each of us has adults and relatives, and many of our viewers have crossed the 40-year mark. Meanwhile, it is known that the older we get, the higher the risk of heart attacks and strokes. And today on our show, we will talk about what thick blood is, why it is dangerous, and why it is vital for blood to be fluid. With you is the head of communications for Synthesit, Alexander Sakhnov, and the first category doctor, head of the therapeutic and diagnostic department, Ekaterina Alexandrovna. Ekaterina Alexandrovna, good evening. Please tell me, why does a person need blood, and why should it flow to every little cell in our body?
Good evening, Alexander. Blood is an integral part of our body's internal environment. Blood flows through the vessels. The vessels are arteries, veins, and capillaries, as you can see from the slides presented. This way it will probably be better. Every organ, every little cell is enriched with a blood vessel. With a capillary, notice how dense the network is, something we might not have even thought about. And, of course, blood must have good rheology, good viscosity, so that the blood cells don't stick together, so that the function of the blood vessel as a transporter can be carried out.
And if the blood cells stick together, what happens?
Microthromboses occur. Microthrombosis and maybe even macrothrombosis. As we know, unfortunately, that's the way it is, and nothing can really brighten this picture for now. But the mortality rate from cardiovascular diseases remains the highest.
For a person, the word microthrombosis, it's like, well, I think it doesn't really mean anything. If I understand correctly, microthrombosis is like a little clump of stuck red blood cells that gets stuck somewhere in a vessel, and it doesn't let other blood in to bring oxygen there. Yes, if it doesn't bring oxygen, let's say to the heart cell, what happens to that cell?
Cells without nourishment die. Naturally, this process is restored. We all know that new vessels are formed. The body is an amazing thing that has developed adaptive reserve mechanisms, and, of course, if it's a micro-injury, the body will manage. And if it's a macro-injury, then we definitely see the clinical signs of a heart attack, myocardial infarction, stroke, or brain infarction. Well, and accordingly, all the accompanying complications and further consequences.
It's amazing. When I was preparing for this broadcast, I looked at how many people search through Yandex each month. A query, for example, prevention of heart attack, and how many thousands of people do you think search in Yandex per month? This prevention of heart attack?
I'm not ready to answer.
I think that, well, about 3,000 people. 3,000 people for the entire Russian-speaking audience. And how many people do you think search for phrases after a heart attack?
More.
In fact, it's significantly more, meaning there are over 100,000 people. So dear viewers, please pay attention. This is very important. Blood. It's not just about going to get tested. Check your cholesterol, LDL, etc., and other indicators. Blood is not just about stopping it when you cut yourself, right? Some other moments. Blood, it's a vital part. It's what allows us to live. We cannot live without blood. This is very important. Specifically to carry out prevention, that is to ensure that it remains in a liquid state, that its rheology is normal, so that it flows well. And Synthesit is the only product in the world that helps to quickly restore this blood rheology. Let's take a look. I'm asking to play the video now. Let's watch the video. It's interesting regarding the effects of Synthesit. Ekaterina, what do you think of this result? Do you think that the effects of Synthesit can help in the prevention of heart attacks and strokes?
I think it can. Actually, it is indeed the case. There is an amazing evidence base. And, I often hear from people, patients who come in for a consultation saying that we take a quarter of an aspirin or some other aspirin-containing medication. I don't see it that way. A healthy person shouldn't take medications. First of all, it's a toxic effect. It's a constant intake. I am an absolute opponent. This kind of intake should not be done without a doctor's prescription. If we're talking about some auxiliary means, it's definitely necessary to get a specialist consultation, but it has an evidence base. And since this medication is available, I think there are no obstacles to doing such prevention.
Yes, especially since Synthesit, unlike some other products, does not cause side effects on the same level. The gastrointestinal tract, on digestion, other products can, I know, cause complications, but Synthesit, despite being iron, is a type of iron that actually helps restore digestion. There's also a bonus. In this regard, it works. Dear viewer, I have been taking Synthesit for 3 years. In our video interviews with Synthesit consumers, I showed my test results. Excellent results. There can't be an overdose of it. I've tested it on myself too. It has been shown that for 3 years in a row, I take Synthesit from 1 to 3 capsules a day. If I somehow overworked myself, yes, or if there's something well known, this ailment that was going around, I increased the dosage. And so this summer, I specifically went to get tested. I hadn't done any tests in a long time, and I got my results back, which were excellent. Everything is exactly normal, right in the middle, not going beyond any limits. That's why I use Synthesit. The product is very useful, indispensable, and there are no analogs to it. So it's specifically about its effect on red blood cells, and it has many different effects for which there are no analogs. But this effect is the fastest. It can be checked under a microscope. So before Synthesit and after Synthesit, all of this is clearly visible.
Yes, Alexander. And of course, in terms of prevention, this is an important factor. This is the intake of pure water. These are measured physical activities that I constantly talk about to everyone.
Balanced nutrition is good, but I suggest we take a look at another interesting video about the effects of Synthesit. The one that's also related to the cardiovascular system. Please set it to medium difficulty for us.
In general, I used to visit a cardiologist every 6 months for treatment, but after taking Synthesit, I haven't needed to for 2 years. I feel like I visit the cardiologist less, my shortness of breath has decreased, and my hair has started to fall out less, but I think that's because of Synthesit, dear viewers, completely.
You can watch this video on our channel, that is in our VK group on YouTube. Subscribe, watch, we have a lot of videos. There are already more than 340 interviews posted with people, doctors, and professional athletes. Ekaterina, watch this video. What do you think of the result?
Well, the result is certainly good, and I'm very glad that the person feels satisfactory.
Many of our consumers, when they start taking Synthesit, find that their blood pressure stabilizes, even though they have had hypertension their whole lives. Not only do they stop measuring their blood pressure, finally, one more thing. Then they stop taking Synthesit and the pills, they stop drinking them, and they wait until they start having issues again. So, it's kind of a complex question. Dear viewers, please take this very seriously. It's important to pay attention to prevention. Prevention of cardiovascular diseases in general. If you feel that something is off, that you don't feel quite right, it's better to consult a specialist, a doctor, and start prevention. That is, it synthesizes a thing that allows you to restore vitality as much as possible. Restore your energy to the maximum, restore blood parameters and overall body parameters. The sooner you start using it, the lower the likelihood of developing serious diseases. And now we will watch another video, which is related to another scourge of thick blood. With a stroke, I would like to ask you to play this video. In 2015, I had a stroke. There were problems with speech. Oh, so it even reached aphasia, right? Well, I'll try to show you how it was for me. I'll tell you, I couldn't even believe the results. It happened. Why? Because I even went to the gym. A unique case, dear viewers. I even went to the gym. A unique case, dear viewers. You can also watch the full video on our YouTube channel or in our group on Vkontakte regarding the fact that thinking, speech, and memory are restored. Basically, when you take Synthesit, even if you haven't had a stroke and you seem to be functioning normally, once you start taking Synthesit, you feel that your thinking and memory improve. You start forgetting words less often, you begin to think faster and react quicker. And you seem to be functioning normally, but once you start taking Synthesit, you feel that your thinking and memory improve. So you start forgetting words less often, you begin to think faster and react quicker. That's normal because the blood supply to the brain is being restored. Sleep improves. Here, Ekaterina. Question. Maybe this isn't in your area of expertise, but who knows, as they say, what happened to Andre when he restored his speech after 6 years. I restored my memory with the help of Synthesit. For example, how I see it, I know that if this higher nervous function, memory, and speech haven't recovered within a year, then usually doesn't recover after that. And this case is probably some kind of exception. Have you encountered something similar or something like that?
In fact, you are right that the time frame for restoring nerve activity and for recovering patients who have had a stroke is quite short. A very important factor is indeed rehabilitation, specifically the care for these patients. And maybe, well, of course, the scale of the disaster, so to speak. But can you show perhaps what happens in the brain if it's visible? Here are the vessels that lead to the brain. Well, probably. The blood vessels of the brain are the topmost slide. There are a lot of them of branches, and in one of the branches there is a blockage.
Yes. What do we have here?
This is all a network of capillaries that are organized.
How many capillaries are there in a human brain?
Well, probably about that much.
Dear viewers, please pay attention. I'm sure that for most people the brain is just some kind of structure, like on our mannequin. It looks like a walnut. And don't even know that there are so many capillaries there. And what happens when the capillaries get blocked?
A blockage occurs, and part of the brain is left without blood supply. Well, let's say the blood supply, the frontal lobe, has been cut off. And we suffer the corresponding functions that are controlled by that particular area. The brain and heart muscle, as you know, are very sensitive to a lack of oxygen. As an interesting fact, there's a fainting spell, and everyone gets really scared. Everyone immediately starts to resuscitate and provide help. And fainting is just a protective reaction of our body to a lack of oxygen. Stress cuts oxygen, causing fainting. Lying down aids recovery. In a confined space, there's some kind of stress, oxygen is going somewhere, and there's not enough for the brain. A signal is sent. The person takes a horizontal position. The brain takes in as much as it needs, and the person comes to on their own, without any help. This is a trivial example that happens to everyone in life, but it's a clear sign of how the brain functions. How badly does he feel, and how much oxygen does he need? How hard it feels without oxygen? Therefore, naturally, good. Blood supply is essential for the proper functioning of the brain.
What would you recommend to our viewers? What are some basic truths on how to prevent a stroke? I'm not talking about Synthesit, I get it. What general recommendations are there?
General recommendations, as always, are banal. I've probably mentioned them to you more than once, but I'll repeat, it's all because of the same story about a healthy lifestyle. Lead an active lifestyle. Don't abuse alcohol or smoking. Drink enough water. Make sure to sleep 7-8 hours a day. Well, of course, avoid stressful situations.
Dear viewers, avoid stressful situations, use effective methods, effective medications like Synthesit. Be healthy. This was Alexander and Ekaterina Bogdanova. Stay healthy. Alexander and Katerina Bogdanova were with you. Synthesit. All the best. Goodbye. Goodbye.